Recording in progress.
Good morning, everyone. And thank you all so much for joining us today. We are so glad you're here and look forward to an engaging time with you in this important conversation. My name is Kim Rollinson, and I serve as the Community Impact Manager here at the Center for Community Health Alignment and also one of the co-leads of the Southeast CHW Network. Welcome to Before You Knock. Safety Strategies for CHW Home Visits. This is the second webinar being offered as part of the Professional Development Days hosted by the Southeast CHW Community Health Worker Network and sponsored by Johnson & Johnson.
Okay, what you say?
The goal of the Professional Development Days is to provide a space for CHW
Yeah, who all you need?
for peer education, motivation, leadership, development, and relationship building. I'm sorry, I had to mute that person. Home visiting is a critical part of the work community health workers do every day. In today's session, we'll focus on practical strategies to help you stay safe while conducting home visits, all while maintaining professionalism and building trust with participants. We're also excited to hear from our panelists who will share their real world experiences and expertise on this topic. Before we officially get started today, if you haven't done so already, please take a moment to introduce yourself in the chat by sharing your name, whether you're a CHW or an ally, the state you are joining us from, and one thing you're looking forward to as summer approaches. Just a few quick housekeeping items to help our session run smoothly. Please remain on mute unless you are speaking. This helps ensure everyone can be heard clearly. Feel free to take care of your personal needs as we go along. We'll have a dedicated question and answer period at the end, but you're welcome to drop your questions in the chat at any time. This session is being recorded today, and the recording, along with any shared resources, will be available on the Southeast CHW Network webpage in the coming days. And finally, there will be an evaluation at the end of today's session. Once completed, you will receive a certificate of attendance. Again, thank you so much for being here today. We truly appreciate the work you do and your commitment to learning and advancing our workforce. We're looking forward to a great session together. Thank you so much. And at this time, I'm going to turn it over to Andrea Lee.
Hello, everyone. My name is Andrea Lee. I have the pleasure of working alongside Kim at the Center for Community Health Alignment, where I serve as our Associate Director of Operations. And I am also a proud CHW and super excited about today's topic. Before we get started, we want to know a little bit more about who is in the room. So we're going to cue a poll. I think Sarah, my good colleague and friend Sarah, is going to start the poll, and we'll take a few minutes to respond to the questions there. And following that, just to orient you to our time together, I have the honor of serving as our moderator for our panel session. As Kim mentioned, we will have a Q&A because we want to hear about your experiences and things that are happening in this space. And then we'll close out again, as Kim mentioned, with the poll. So take a few minutes to answer the questions. And after that, I'm excited to hand it over to Soledad, who is going to share some best practices just to frame our conversation for the day.
Yes, thank you so much, Andrea. I'll give you guys a couple of seconds. I know the poll is up, it went out. As Andrea mentioned, it's important information so we can keep webinars like this coming to you. But thank you. It's great to see you all today. I see some familiar faces, some new faces. Just know that there is more to come. This is such an important topic. We're so excited to have you all in the room today. And again, my name is Soledad Bolden, and we are just excited to just be here, and you'll get to learn more as we go. Let me wait for a little sec, like 5 seconds. Just get these polls in. I know they're coming in. All right. Okay, and then we'll start with overview with home visiting. Now, those of you who are currently out in the field, put in the chat me. If you are currently, not currently, you shouldn't be currently out in the field while you're in this webinar, meaning that you visit members, you go to their homes, type in me in the chat. If
What?
you are current, like if you visit, you do door knocks.
This shit is like literally cutting off my circulation.
If we could mute ourselves. Yes. If you do door knocks, you're out in the field. I know we all have different terminology, right? You are boots in the ground. Just put me in the chat. And I know a couple of you are putting me. Yes. So we know that home visiting is meeting the community members where they live, right? Most direct and personal ways to come to work with community members, focus on the whole person. Right? We got the health, the environment, and the social needs. And most importantly, you're building trust, especially in underserved communities, right? They're seeing you face to face. So a little about me, I'm a CHW. I've for over 11 years now, from knowing what a CHW was, right? But been doing it way before knowing the exact title of a CHW. And I've been doing door knocks in so many different communities. And not only that, I've also trained and supported CHWs out in the field. So why does home visiting matter? Right. So we have some evidence. There are some evidence, according to the CDC, that chronic disease management improve when care is delivered in community settings. So it could be you're at the library and you have you're having sessions with families or the community. There have been shown to that there is support. Like when CHW step into the room, they have seen, and I'll drop some numbers shortly, right? So also the Health Resource and Services Administration notes that home visiting improved birth outcome and parenting practices, right? So we've seen improvement maternal and infant health outcomes, and you'll hear from Rebecca that will speak more about that, reducing hospitalizations and ER visits, right? Increase medication adherence as well. So between 30 to 40% reduction in hospital readmissions. It shows that CHW led interventions, that's where between 30 to 40% reduction in hospital readmissions in a 30-day when you're contacting the client within 30 days of them being out in the back in the community. So there is a 30 to 40% reduction in hospital readmissions. So our work is important at CHWs. So home visiting, regardless wherever CHW, if you're integrated inside of the clinic or you're out in the community doing services in these different settings, knocking on doors, finding members, right? What you're doing, there are track records for the support that you're providing. So there's another a source from Agency for Healthcare Research and Quality. It said that between 20 to 25%, there are fewer emergency room visits. So CHW involvement, it leads to better follow-up care and fewer preventable ER visits. So having that face to face, going to the homes, it makes a big difference. We are the bridge, right? We are the bridge from the facility and the to the client. So we're showing that there are numbers that showing that the home visiting is really, really, really important. All right. So you can find those numbers in within the CDC platform and also the Agency for Healthcare Research and Quality. All right. So we know that there are some risks in home visiting. All right. And I want to take a moment and talk about that right now. So as CHWs, we face environmental hazards, right? Which means that poor lighting, unsafe structures, right? Exposure to violence and unsafe individuals, right? Animals, I know this on the screen is a cute puppy, right? But not all animals, right? We always have to still be alert. Regardless of how cute the puppy may be, we still have to be alert, right? So we have animals, substance use, or mental health crises, right? That we're entering. And at times we don't even know what we're entering until we're there, right? We'll be speaking about so many different factors that come into that. So the National Institute for Occupational Safety and Health highlights it says that community-based workers are at increased risk for workplace violence and unpredictable environments. That's why this is so important. Community-based workers are at increased risk for workplace violence and unpredictable environments, right? So even if you've been to a neighborhood before, like you've never had an issue, you can't get too comfortable. Just know, like, oh, I'm good. I don't have to worry about. I know where I'm going because it's unpredictable. You never know. So as a CHW, it's good to understand these different practices that we're going to be talking about today, so we always stay alert. Okay. And it's important to have safety protocols in place, right? Workplace violence is a leading cause of injury in healthcare community work, right? Studies show that training and protocols significantly reduces risk. So it doesn't matter if you've been living in the neighborhood that you've been serving in, right? Still having training and different protocols, it can help, it could support in reducing any risks. Okay. So I want us to understand that safety is not based on fear, right? I don't want us to be in fear when we're thinking about home visiting or anything like that. It's about just being aware, right? So remove anything of just being fit. If you've been a CHW for 1 month to 15, 20, 30 years, we don't want to have that fear, right? It's just being aware, all right? We can't serve the community effectively if we're not aware, right? And if we're not safe. So that's the number one. You have to be safe. When we're talking about going out in the field, that's the number one thing when it comes to home visiting. All right. So we have some key responsibilities. The health education when we're commuting with the families. We have resource navigation, providing housing, food, transportation, emotional support, and trust building. Right. I've mentioned before that CHWs are the bridge between the healthcare system and the real life, what's going on in the community. Right. So we are assessing our surroundings. Okay, we're talking about before we even knocking on this door, before we going into the home, into the apartment building, before we even start driving into the block, before you get into your car, right? Before you use public transportation to get to clients' homes. I know we're all in different parts, right? Some of us are in inner city areas, some of us are in suburban areas, some of us are in rural areas. Right? Safety starts before you even get into your car to get to the client's home. All right. So trusting your instincts, setting boundaries, knowing that you don't have to enter every situation. Okay. Following your agency safety protocols, check-ins, buddy systems, right? You have to understand that you don't have to fix everything. I know CHWs, we wear so many different hats, right? But you're not expected to fix everything. You're not expected to solve every situation, right? You're expected to to stay safe while you're serving the community. That's number one. You got to stay safe while you're serving the community, because there is a lot that we do, but we have to understand that there are protocols, right, that you have to follow, and you don't skip those protocols. I know every agency have their own. It could be a buddy system. Some may have a notification or a button even on the phone app. Right, we'll speak about a lot of that when we get to our panelist discussion. So there are so many things. Now, this is one thing that I want to talk about, right? And I want you to look at the screen before you knock, right? Before as your checklist, okay? Just thinking as before, background check, the client history and notes. I know not all agencies. So one of the organizations that I came from, before a client comes to me, there are background checks. Right. There are some background checks that are done, but I know we all don't have that capacity. Not only that, sometimes the background check is not taking everything, right? From what they depend on the system that they have. We're not seeing everything. Sometimes we'll get the red flag while we're there and the person's home. Right. So just being mindful of that. Environment scanning the neighborhood, be mindful of the time of the day. We know that now it's getting lighter, like it's staying lighter longer, but in the winter time, you don't want to be out in the field at 4 o'clock or 5 o'clock, depending on where you live, right? I know in like the northern states, once it hit like 4 or 5 o'clock, it starts getting dark. In the southern states, once it hit like, I guess later time, 5 o'clock, it's it's still a little bit light, right? So just knowing the time of day and if you should be at that spot at that time, right? Find your exit. Always know how to leave. Always know how to, if you got to take, if you enter in the building, if you got to take the steps. Some buildings the steps are probably not the safest place to take, right? But knowing, understanding, maybe it's the elevator that you have to take, or finding a different route in the. Yes, so I know some of us know exactly what I'm talking about, right? So observing before entering. Okay, that's observing before entering, the sounds, the people, the activity. Observing before entering goes with R, risk assess. Your gut feeling speaks. Your gut's feeling speaks so much. Sometimes it speaks louder than what you're seeing, right? So I remember going into a neighborhood, just driving, and it just felt weird. There were people on all four corners of the street, and there was a person in the middle, basically like giving a signal like you don't need to be here. I ain't need nothing else. I was like, let me drive on back home or go to my next client, knowing your gut, right? In my mentality is like, I got to help this client. I know this client needs help. But if the neighborhood is already telling me a different story, reschedule, right? So, and E, establish boundaries. Decide before you go in. What are your boundaries, right? What are your boundaries? And again, knowing what your agency is requiring, comparing that to what is actually happening in the community. So it's going to take communication with what's happening in the community and what your agency is saying, right? So it's understanding the boundaries, knowing before you go in. Don't let things catch you by surprise. Okay, always, and you'll say this. Some people already know this. When you go into a public place, depending if you're by yourself, don't have your back to the door. Your chest should always be facing the door. Any exit, so you could get any emergency that happen, you're quick to get out of there, right? So knowing the difference, I want to just talk about yellow flags and red flags. Okay. So we have some yellow flags, right? That would be the loud TV music. I mean, the loud TV music. Just something that's just too loud when you're in the house. That kind of messes with your five senses, right? Your hearing. You want to make sure your five senses are clear. Right. So if one of them, especially the loud, just think about this. You guys know when you're parallel parking, you got to put the music down, right? Because in a way, even though the music has nothing to do with you driving, but some of us, when we're parallel parking into a spot, we kind of put the music down because you want to focus, right? Same thing. So kindly say, can we put the music down? Can we put the TV down? Right? Multiple people, unknown people, that's a yellow flag in the house, right? You have that conversation before your client. Who's going to be in the home? You're entitled to ask that question. You need to know, right? Are there any loose pets? Right? Even if you're a dog person, right? Still ask that. Even if you're good, you're so good with pets, you're good with dogs, always ask. Always ask. It's best because you don't know how one may train their dog, okay? Or their pet. All right. So if and even if a client seems agitated, right? So this one right here is a little bit more for season, like and I'm be honest, for seasoned CHWs, sometimes we know how to like speak to a client if they're agitated, but you know when it's like, all right, this ain't that type of visit, right? So, and then the red flags is just don't enter, don't go, reschedule, right? If there's active conflict or yelling, okay, visible weapons, signs of substance use or intoxication, right? You feel unsafe and you really can't explain why. Okay, you feel unsafe and you can't really explain why. So sometimes even if you speaking to the client like, hey, can we meet at this coffee shop or at McDonald's? I've had to do that a couple of times, right? So it's just having that and being okay with that. Being okay with say, hey, I'm gonna be in this area. Can you meet me here? And it's probably not far from their home, right? Just doing that, right? So you want to be impactful for the family, for the client, but you still have to think of your safety first. All right. Then I want us to how do we craft something when we say it's good to notice in advance, especially when it's hard for you to make somebody else feel uncomfortable, right? But knowing what you need to say when you need to leave, right? I'm going to step out and reschedule for another time. This doesn't feel like a good time for a visit. Let's reconnect another time. I want to make sure we're both in a good space for this visit. So if that person is irritable a little bit, um, just maybe saying that, right? Positioning and body awareness, right? So even with that, if it feels like a little tense or you kind of like feel uneasy, just know, okay, you kind of have to leave. Not kind of, you have to go, right? Keep your personal space. If you feel like the person is taking over your space, kind of stepping back, and then that last part, no, let's reconnect. We could reconnect another time. I know sometimes CHWs we may feel pressure to stay, right, in a situation, but you're not helping anyone by staying in an unsafe situation. All right. You may often feel like I don't want to be rude, or the client needs me, or I'll just push through. The moment you start thinking that, it's time for you to go. Okay, the moment it's you have to think of your safety, because at that point everything is getting blurred. Your five senses are getting blurred. You're not hearing correctly. You're not seeing what the issue is. Whenever you're saying, "I don't want to be rude," or "I'll push through," that's when you just need to go and use one of these three. Okay, use one of these three. Or you have an important meeting that just popped up. You just make your way out the door. Okay, so I know I said a whole lot, and I hope we all could resonate with some of this information, right? But there's more to come. So what we'll do now is we're gonna move into our panelist discussion. So you could hear a little more about the home visits, what happens, what are some protocols, what are some advice, what are some support for some other CHWs that's been doing this for a long time, and you can get the advice and the support that you need. So you're not going to leave out of here confused or not knowing. You're going to leave out of here so confident that you're going to be able to acknowledge and see all of these that's happening and be effective in the work that you're doing. Okay, so I will pass it over to Andrea.
Awesome. What great nuggets Soledad provided us with. And I'm even more excited to hear from our panelists today as we dive a little deeper into safety strategies for home visits. And so Soledad will also join us as a part of our panel. Before we kick off, I'm going to ask each of our panelists to introduce yourselves, let us know who you are, what you do, and how long you have been conducting home visits. And we'll start with Miss Lily Fox.
Good morning. My name is Lily Fox, and I am the Senior Program Consultant at CHW. I have been a CHW before it was called CHW. And in my lifelong role, I've completed many home visits, decades of home visits. And I've attended trainings on how to conduct home visits. And just one thing I will leave is that each visit is different.
Awesome, awesome. Thank you. Soledad, any new facts you
Yes.
want to share with us?
Any new facts? I would say I've done inner city, supporting clients in the inner city, the suburban area, and rural areas, and they're all different experiences. So, and I truly love all of them because I've learned so much, in my role as a CHW, being in those different settings. Yeah.
Thank you, thank you, thank you. Rebecca.
Good morning, everyone. I am Rebecca. I am currently serving as the director of Birthright of Columbia, but I have been a community health worker since 2016. It's been forever, but I can't imagine my life without it, without doing this work, without doing home visits. I was even doing them before I even knew what a community health worker was, before I knew what a resource mother was, which was my first title as a CHW. So,
Thank you, Rebecca. And Jaquetta.
Good morning, everyone. My name is Jaquetta Graham. I am a program coordinator, and I'm a certified community health worker. I have been doing home visits for about 13 years now. And I've been a CHW forever, doing the work without a title. Yeah.
Thank you, ladies. So excited to hop in. So Soledad, in her presentation, dropped lots of gems. One thing that Soledad said really stood out to me, which was safety starts before you get into your car to get to your client's home. So we're going to dive a little bit into safety. I'm going to start with Jaquetta, but of course, everyone chime in. So my first question for you all. What policies or support should organizations have in place when it comes to safety and supporting CHWs with home visiting?
So when it comes to safety, the policy should go like, first off, how many is going on a whole home visit? Where do they need to leave their location? So if they need to put it on their calendar, if they need to let the front office know, if they need to send an email out to a couple of people saying, hey, I'm going on a home visit. This is where I'm going. Make sure the provider or knows that you're going to conduct a home visit with their patient, or if it's not a patient, just make sure your organization know where you're going, who you're going, and also take someone with you. There should be something put into place when there's two people in the home and it seems like something's not right, that it's a way for them to get out. So meaning the other person should know, if I give you a nod or if I wink, that means to call my phone, my work phone, or send a message so I can just play and say, oh, I'm sorry. This is my boss calling, we've got to go. That will kind of get you out of the way. And then once you get into the home or a restaurant or library or whatever, always watch for your surroundings. Four eyes is better than a set of two. So make sure while you're sitting down with the person and talking with them, the other person is actually engaging, but also watching around what is going on around you all.
Messages that they send to something within mobile versus those that require an explanation.
Awesome. Thank you, Jaquetta. So I'll wait 1 second. I think someone is off mute. But lots of great gems. Just curious, Rebecca, Miss Lily, Soledad, anything to add? And again, the question is, what policies or support should organizations have in place?
Yeah, yes, I could jump in. Definitely anything that has to do with safety, right? Anything that has to do with safety, the buddy system, everything that Jaquetta mentioned. And there are so many different apps out there. In the organization that I was in, there was something called Guardian MPS. It's an app on a phone that is like a red button. First of all, every time you stop at a stop, you record where you are, right? You say the address, so you're in the car stating where you are, and then you time yourself. If I usually do 60 minutes, right? So if it goes over 60 minutes, it gives you like a little bit of countdown, and if you don't press the button to restart, it will dispatch to call the police, or they will be calling your phone or your supervisor's phone, and then it's a whole protocol. So I put the link in the chat. So there is an app. So it will call you first. You don't answer, it's calling your supervisor. Your supervisor don't answer, it's calling the police. And it's a GPS system where it pings wherever you click that I'm at this location, it pings it. So because we were short staffed, we couldn't do a buddy system. So that was just another protocol that was utilized at that space. So sometimes we could, but a lot of times we couldn't have a buddy system. I hope that helped.
Another tip that I use is I carry my phone and
Mhm.
I have 911 pulled up on the phone. So if things don't go quite right, I just, it's like on speed dial, I guess you would say.
I would add also make sure that if you don't have a badge with your name and stuff on it, make sure you have something that tells what your name is and what organization you're coming from. I typically like to, even with working at Care South, or conducting my own business, I've went out and had a magnet made to go on my car as well. So when I'm conducting
Yes.
a home visit, that magnet is there because a lot of times when you're driving through the neighborhood, it's a different car. People tend to think, oh, who is that? What's going on?
Mhm.
And so it sends a different signal. And even when you pull up in the yard, especially if you might pull up um in a yard and that person no longer lives there. So make sure there's something visible that represents who you are.
Mhm.
I like that idea, Jaquetta. That was a good one. I always carried a clipboard with me, and on the back of the clipboard, I had like the logo for where I worked. So that way I'm carrying it and they can see very clearly that I'm with this hospital, I'm with this agency. And then I always have my name tag as well. That way they could see something. And I tried to never be digging around in my trunk when I first got to a place, but to have all that stuff in the front seat with me. So I would stop at a gas station right before, something like that, to make sure I wasn't digging in the trunk or doing something like that that would make it look suspicious, because if you're digging in a trunk, they see your back and they're that you're in a trunk and you could be doing anything. So just always come to the home visit fully prepared, ready to grab everything and get to the home just in case, because sometimes the home is safe, but the neighborhood is not, and you never know.
Oh yes, I agree with that, Jaquetta. That was definitely one of my protocol. Everything that I need was in the front seat. I didn't go in the trunk. Laptop, I try not to even put anything in the back seat under my seat because people are watching and your car, um, based on you park in front of someone's house and let's say the apartment buildings are up or even the house is like 2 floors, they could hover and see what you're doing inside of your car. So you think about that stuff. Um, be, because that's part of safety. So you're not trying to hide something under your, if you forgot and you didn't get the chance to go into, I did that same thing, going to the gas station to, fix myself up like with my bags or whatever. If you didn't get that chance to do that, just take it in there with you. You're gonna have to just take your laptop because people are watching, and just have a clipboard, or just show that you're working, like you're here to work, and sometimes a stern face when you're walking in the neighborhood, like don't mess with me type. I've done that, and yes, the friendliness also helps. But there are certain neighborhoods, because I'm familiar. Like I don't have time for you to try to holler at me while I'm walking for work. Sometimes a stern face makes a difference. So it's again that gut feeling, and the walking fast because you're showing that I'm busy. I don't know. That's just one of the things that I've used. You just walk fast with your clipboard or because I'm busy. I can't stop and talk to you. I need to see his client, and it's too many, people outside. There's so many different things that I've definitely had to trial and error, had to try to do.
Yes, thank you all. So many gems being dropped. I see lots of things popping off in the chat. I'm going to shift gears a little bit because I know we focused our session so far on safety and the importance of that with home visits. But I don't want to miss, I know we saw a lot of me's when we asked who's conducted home visits. But for those where this may be a newer area, can you describe for you what a typical home visit entails? And we can start with, let's see, Miss Lily.
Can you repeat the question?
And in your experience, what has a typical home visit look like? Thinking about a CHW who may not have had an opportunity to do one to date.
Oh, a typical home visit for me, when I think back to when I was first getting started, the anxiety level is very high because you don't know what to expect. You don't know how you're going to be received, and so your anxiety is very high. Um, so the client is concerned because for many reasons. It could be you're there to talk about their benefits, or you're there to gather information on decreasing benefits, or cutting the benefits out. So once you get past that, each visit is different depending on the environment, the dynamics of the family and the home as a whole. The first thing I notice in change is a sense of relief once you explain why you're there and who are you connected to. Um, and that it has one of the main things that I usually do is let them know I'm not here to talk about your benefits. I'm not here to gather information about your benefits or pass on any information. And then a change will come when you explain to them the meeting remains confidential unless they tell you something that's a threat of harm to themselves or others. That's it.
Yeah, so
That's it.
hearing you loud and clear, those first time jitters are going to be there. So to be anxious is to be expected, but hopefully some of the tools and strategies you're hearing today will be supportive in those instances. Anyone else want to share what does or has a home visit entailed for you?
You never know what you're getting into, or what you're walking into. Just keep in mind, everybody's home is not going to look like your home. It's not going to be equipped with what you're used to having at your home. So make sure you fix your face expression before you walk in. Just because the outside looks one way doesn't mean the inside looks one way. And just because the inside looks one way doesn't mean the outside looks one way. So make sure your gesture is always straight, and that you're not panicky and looking around like, oh, something's gonna crawl on me. Um,
Mhm.
and if you're a person like myself, I typically don't like to sit down when I'm speaking. Even when I introduce myself, I always ask, can I stand up? Because I feel like that's more authority in the room. So if that's your comfort zone, just say, oh no, I'm okay with standing. I get work better done standing than sitting. Just so if you feel like kind of anxious, if it's your first time going, because if not, you're gonna lose the trust between you and the person you're there to see with and what you're there to do. They're really not gonna trust you. They're gonna think like, oh, you're judging me, and I better not say too much because DSS may arrive or whatever, whatever. So if you want to get the job done, be yourself.
Yeah. Yeah. Absolutely. I agree with both. Same thing. Uh, Being mindful of what the tradition is in the family. If I've come into a home and I have to take off my shoes, I respect that. Um, and same. But Jaquetta, what was different with the organization I had, they a lot of times before COVID, they would recommend that we sit. I know sometimes it was a little uncomfortable, but I've gotten used to just having a seat in the home, right? So it is different. I know some may not want to, and that is very interesting because it was one of the protocols of our organization. But obviously, we're mindful of every home is different. But I would usually sit. In the home and and engage in conversation. And yes, shoes. If they don't want shoes in the home, I respect that. Um, I see in the chat water, food. I That's where I'll say no. Um, your views about food or drinking water in the home, I'll say no. I have water in the car, and they'll respect that. I've had the families, that's how they welcome you, right? With offering you food, offering you something that they're making, especially if they're currently cooking. Yeah, but it was a protocol that we couldn't accept. We couldn't accept that. So
Yeah, with the water, I usually take a small bottle of water with me
mhm,
in the home, and
mhm,
make sure I either drink out of it or pour some of it out to let them know that it is, that I do have water. So that's the way I get around the water, because we have to be very
mhm.
cautious with cultural, like Soledad
Yes.
said about the shoes. So depending on the culture, any and everything can offend them, and that you don't want to do, because if you do that, the game is over before you get started.
Mhm.
Thank you all.
Yeah.
I'm coming to you, Rebecca. I call her the baby lady. But Jaquetta mentioned something as she was speaking earlier, and she really uplifted trust and being okay with being yourself. So can you talk to us a little bit about how do you build trust and rapport during home visits?
Sorry, I got stuck on mute. So building trust and rapport is always an interesting thing to do. And it's something that you start before you go out on the home visit initially. When you make that first phone call to schedule that visit, you tell them, first of all, who you are, what organization you're with, and why you have their name and number. Because a lot of them, they're just like us. When you get that random phone call, you're like, well, how'd you get my number? Why are you calling me? So treat them the way that you would want to be treated by telling them, okay, I got your number through a referral and it came from, like, try to know who that referral came from, because they will question it so many times if you don't. So it could be their insurance company, and try to have a name for that referral source as well. Because I became really good friends with our referral sources at First Choice. And I'd be like, yeah, Miss Carolyn sent me your name and number, and this is why I'm reaching out. She mentioned that you were pregnant, and this is what we're going to be talking about. And try to have some kind of background information on them and show that you know and that you trust. Also, have a little vulnerability and be like, I was scared when I was pregnant too. Um, And then ask them about their home, like, hey, I'm going to come out to your home. Are you okay with that? Always make sure that they're okay with it first. And then if they're not okay with your first meeting being there, what I would do, I'd be like, I can meet you at your doctor's office in the waiting room before your appointment. I can meet you at the library or a coffee shop. Try to have some place to meet with them. And sometimes they don't want to meet at first. They want a few phone calls. Um, a lot of agencies, they do have a little leeway on some of that to give you a little bit of time. Just be like, I do need to see your face at some point. Or like, I'd really like to see your face. Like, try to make it more personable to let them know that you actually want to be there and you want to help them.
And can I just say something real quick? Oh, sorry.
No, go ahead, Celia.
Okay. Shantini made a great point that is in the chat about knowing in advance like what's happened um in the like I guess in the area before, just knowing about community tensions, and also just being mindful of how we talk about these different places. Yes, we know that not all not having stereotypes are definitely not should not be your go-to. Oh, because you're in this certain neighborhood, this is what's going to happen. That's not the case, right? Like I mentioned before, it could be a neighborhood that you've been going to, a home you've been going to for months, and you've always felt safe. But anything could happen, anything could change. So it's always good to be alert, regardless wherever you are, because your safety comes first. Yes, and I agree. The language you use and the stories you share can sometimes reinforce narratives that don't fully reflect every community's experience. Yes, Shantini, I agree.
Thank you all. I would love it if each of you could share one success story that shows the impact of home visiting.
Um, this is home for me because I have a passion for diabetes. And so I had a person that was not showing up for appointments, was always attending community events and then stopped showing up for community events. So everybody was kind of on alert, like, where is this person? What are they doing? Um, and so I showed up at their home. And it wasn't scheduled. And I saw somebody in the chat say, what about if it wasn't scheduled? It wasn't scheduled, because I couldn't reach the person. So I just kind of showed up. Nevertheless, I showed up and they were sitting on their porch because they didn't have any lights. They didn't have any water. The tire was flat on their car. So with the resources I had, I was able to get their light bill paid. I was able to get their water bill paid. A guy that saw me out there trying to change this tire and put the spare on, stopped and put the spare on the tire. So the success was the patient was now back in roots with transportation, had lights, had water. And so boom, you're out blossoming back again. So that's my success story.
One of my success stories is to show the impact of home visiting. It allows you to build trust and make stronger relationships. And one of my homes, it was when I went in, it was heavily infested with roaches. They were just falling out the ceiling. They was crawling everywhere. But the the mom and two of the children was mentally challenged. So I never said anything to her about the roaches, but I did ask her if I could advocate for her to get someone to help her with housekeeping. And she agreed. So while I was there, I called, and I think they called it, it wasn't Terminex, but it was someone that actually sprays for roaches. And when I explained to him the situation, he came out and he sprayed her house for free. And then he offered to come back at least one more time for free. But after that, it would have to be paid for. And they was living on a small mobile home, and it was a total of four people in the family. So that's my success story. And because partnering is very, very, I know you didn't ask this question, but partnering is very important because, and I didn't know the gentleman. I just looked in the phone book and randomly picked him to call, and he agreed that he would just come. So people want to help, they just don't know what they what's needed. So that's my success story.
Yes. A success story for me, um, I'll say one of them was it was in the suburban area. The home is like a mansion, big, huge home. And it was an initiative that we were doing for it was different. What we were doing, we was working with a health insurance company. So we had clients information and they'll tell us what they need, right? What the client, what we have to do with the client. And I was looking for the daughter of the family. And when I entered the home, when I tell you, think of HGTV, like remodeled, beautiful. So I explained the father's the one that answered the door, and I explained my reason being here, and then he felt relieved. But because I came in, like even though you have this beautiful home, it doesn't mean that you don't need help. First thing he said was, "I'm glad I get to have help because living in this neighborhood, I know you see this house, you may think I have everything." When I tell you, he said that his life was in shambles. His daughter was on a was on substance use. I don't remember exactly what it was, but she was always leaving the home, always running away. Um, his wife was not around as often, so he was manning the house himself. And he had health issues in himself. So I came there for his daughter to get her support, to make sure that, whatever is needed, that they get the help. And it turned into just a real therapy session. So getting a therapist for the father, and I was able to find the daughter. He didn't know what a daughter was, but I found his daughter across town through Nexus Lexus. So if there's a Nexus Lexus, you could do a search. If the organization pays for it, you could do a search, and all the numbers come up where they have been in the past. And I was able to find her, talk to her, and there was reasons why she didn't want to be in the home and even getting therapy for her. So before to even address any health ailments that the health insurance company gave me, we had to address other factors first. And then by the time I was done, she has built her relationship with her father and her mom. So, and it just started getting better. And it's because of the work that was done to speak to the daughter and the father. So, again, avoid any stereotypes. You think people got it all together, but they need support, right? The home is beautiful. Someone may come like, what issues you have? They need the support is needed. You don't know. You don't know. And yes, so the father needed support, got him connected to he's a veteran. To actively use his benefits. The benefits that he had nothing to do with the organization that I'm working with. This is something completely different. So I had to help him navigate that and then eventually give the support to the daughter. So just bridging that just made a big difference. But to this day, I don't think the daughter's still at the house, but there is a communication that is more regular compared to when they first started.
That's beautiful, Soledad.
Yes,
I'm sorry, my
yes.
phone's gonna go off for a minute. Um, so it's really hard for me to pick just one success story to talk about. Like it really is, and it breaks my heart because I want to talk about all of them. But one of my favorites, and Andrea loves me talking about this door that I used to knock on all the time. It's, and there were pictures of it in a presentation I've done before. But it was one of those neighborhoods that nobody wants to go into um, at all. But I went only during the day before noon, and I would go in there, and there was body fluids and stuff that came out of bodies, and it was smeared all over the door. There were curse words written on the door with Sharpies and paint, and it was stuff that you didn't want to see. But I always remembered that there were babies behind this door. There was a mom behind this door. And once you got through that door, it was actually a beautiful apartment. She kept it clean. Occasionally there would be a bug, but the apartment also flooded all the time. And she was so committed to finishing her GED. She was so committed to taking care of her family and having healthy children. And before I left, I finally got to see it. She moved into a house of her own, and it was absolutely gorgeous. She had custody of her kids. And last week, of course, it was last week, years after I've stopped working with her, she called me. She has finished her GED. And that's things like that, when they track you down to tell you their good news, and they invite you to see their new homes and say, remember when you had to knock on that door? And I didn't use my bare hand, by the way, to knock on that door, but like things like that, those are successes when they want to tell you their good news and they want to share that with you. Those are the true successes.
Yes, echoing Romaine and Shantini in the chat. Amazing, amazing stories, great stories. Thank you for sharing the impact. We've talked a little bit about just the strategies and tips, and I wanted to make sure we landed with the impact of home visits. Really quick, before we close out our formal piece of our panel discussion, rapid fire, ladies. So are you ready? I have 3 questions. I'm going to ask each one, and as quickly as you can, give me your answer. So the first question is, if you could share with us one practical tip you swear by when it comes to home visiting.
Oh, for me, that would be calendar sharing with full details, including the address and the phone number of the place you're going to be at, and telling people to actually check it.
Always having someone with me, regardless of who it is, just always having someone with me.
Make sure someone always knows where you are, and be mindful of your surroundings, and don't also, like in these neighborhoods that we go in, there's gangs and they have different colors, so be mindful of that too.
Be prepared. Being prepared before you get into your car.
And we love that before checklist, so that I screenshot that one. One thing you always do before a visit.
Pray.
Before the first home visit, what I would do is I would Google map the address and look at what the road was like so I can find out, is it paved? Is it like crazy looking? Like, do I need to borrow someone's truck because my little Honda is not going to make it through? And then also to know what kind of house I'm looking for, so I'm not driving slowly up the street and I can look somewhat confident driving to that house.
I prepare myself. I make sure I have everything I need in my bag, including other other pamphlets that I may need for different resources. And then I have my resource book with me as well. I have pen and paper with me. Everything I need for the visit, I make sure I have it there.
I say a little prayer to make sure I get in the mindset to whatever the unexpected may be once I go into the home.
Make sure your phones are charged. That's what I meant to say. Make sure your phone is charged. Yeah.
Yes, definitely making sure your phone is charged and planning out your route, utilizing a website that could fit more than 10, because I would have to see more than 10 people in a day, that could map out more than 10, so you're not driving around, right? So it could tell you the easiest route on how to effectively map your day as a CHW, right? So instead of going to one area and then you have to come back to this area and then go back, just mapping your day, so you can be effective doing your work, because there's a lot that you're doing and you have to do notes, right? Don't do your notes in front of a client's home. You pull somewhere else, go somewhere else to write your notes. If you have a habit of, like, after you see a client, you want to do your notes so that way you don't bring your work home, I understand it, but don't stay in front of a family house writing your notes.
Last rapid fire question. One thing you wish supervisors understood.
That's a good one.
Yes, it is. Oh, let's see.
I would say the drive I have for the community. Because way they might think that the visit should have only took me 15 minutes, it might take me an hour and 30, because
Yes.
even though I might be there for one particular thing, but if there's others, capture what you can capture then, because you might not get that opportunity again, and they might not get the opportunity to say or ask or get the help they need for what they really need at that opportunity. Because a lot of times you're gonna go places where they say you coming for one thing, but it's really something else.
I agree with you, the credit, and I get one of the things too, as well, just to repeat what you just said, is that all visits don't go the way you plan for them to go. And so I would like, would hope that they would understand that there's sometimes unexpected instances that take you longer than when you're expected to be there.
Yes, and I'll say, I know we have supervisors on the call, right? Um, if you've never been out in the field, do some ride-alongs with your CHWs. Do some ride-alongs, and understand that exactly what was just said. It takes more than just like you're giving us 15 minutes, 20 minutes with the client or 30 minutes. Just driving up to the person's home, I'm not immediately coming out the car, right? There's other things that I have to do to make sure that I'm good. I had a supervisor or a CEO do ride-alongs with me, and I could tell he didn't understand what it was about, what being a CHW was about, because as soon as I stopped, he was ready to get out the car, and I had quite a few things that I needed to do to make sure that I'm at the right place, or I have the proper notes that I need to take, or the proper file, whatever it is that I have, the proper information for the client, especially if I'm running from home to home. It's just understanding that there's so many different factors that are in play when you're out in the field. There is not just get in the car and drive and get out and go to a client's home, right? There's a lot that goes into just being in the car. There's a lot that happens once you're in the client's home. So just understanding that, really, and having proper protocols in place will definitely support the CHW, and listen to what the CHW is saying, because they will give you some great advice and some great information that can support to help their work.
I love that, Soledad.
Hmm.
That one was beautiful. One thing that I think as a group, when I worked with a bunch of CHWs, one thing we wished our supervisors would understand was that sometimes it's unrealistic to get all the paperwork done in one visit, because we would have to do all these surveys, all these different assessments, and sometimes it was just unrealistic because sometimes those families were not in the space mentally to be able to do that. Sometimes their lights had been turned off,
Hmm.
or their grandma had just died, or something was happening in their life where they did not want to go through a reproductive life plan with us, or they did not want to even think about what kind of method they were going to use to feed their baby when they were still 2 months pregnant. Like, they needed to process life first. And sometimes we needed to be there to process with them. And then we also needed the time and the grace to process what happened on those home visits. So sometimes we needed that extra time for ourselves as well.
Let's give our panelists some hearts for all these great tips and best practices and the great impact that they have had in their respective communities. And let's also give each of us in here some hearts because we are segueing to hear your questions, reflections, and I've already seen the chat going off with lots of best practices. So we're going to formally go into our Q&A. Kim is going to keep me in check with monitoring questions in the chat. But I did want to kick it off to you, Betsy, because I saw you put lots of great tools into the chat, lots of great tips, and you had your hand raised for so long. So welcoming your questions, reflections, or just the great resources you have to share with this group today.
Well, thank you for the opportunity. I just have a message for you all that actually is in the chat box. It says community health workers step into spaces many never see, into homes, into stories, into moments of vulnerability and trust. Every home visit is more than a task. It's an act of compassion, courage, and commitment. You meet people where they are, often navigated unfamiliar environments, unpredictable situations, and real safety concerns. Yet you continue to show with empathy, with respect, and deep sense of purpose. Your presence brings comfort. Your words brings understanding. Your work builds bridges where gaps once existed. Today, I want to honor what you do. What what do you risk? What you carry? And the quiet strength you bring into every doorway you cross. Your safety matters, your well being matters, and your work changed life in a way that truly cannot be measured. Thank you for being the heart of our community care. And I also shared with you a Word document. It's something that I was working back in those days when I was working at CDC and never had the opportunity to finish it. So it's an unfinished yet resourceful, I believe, for you to take with you all. It's a collection of protocols that I reviewed many months ago, especially when we put together the COVID CHW webpage and the webinar that we did when we addressed, along with Nashua, safety home visits conducted by community health workers. I was looking to the website, but it's not even archive anymore. So it's banned. It disappeared. I was able just to rescue that one pager that I just shared with you. Hopefully that will be useful. Thank you.
Awesome. What beautiful words. Thank you so much for that. I do see some questions in the chat, but if you are wanting to speak, feel free to raise your hand so we can acknowledge you. But we'll start with the question from Felicia. What support protocols would be helpful for organizations to have in place to provide aftercare if there's a past trauma triggering experience during or after a visit, such as a debriefing session or access to counseling, time to recover before the next visit?
Yeah. Do you mind if I take a hit at that? Yeah, that's a great question, and we've experienced that, especially when I was training CHWs. You don't put them back in the field immediately. I know the goal is to you have numbers to reach, but the self-care is much more important than getting them back into the field immediately, right? So I would say some important protocols would be to have them talk it out, spend some time, speak to another CHW who has experienced that. That is going to be important because they could relate to another person that's in their same position. So if you have like a senior CHW, have that person communicate with that individual. And if you have a line, someone at your organization that does counseling, that can help. And the next time they go out, have them go out with someone else, right? Have them have a buddy system. I didn't have the unfortunately, I didn't have the opportunity to consistently have another CHW with me. But whenever there was like a situation or whenever the supervisor would say, okay, we're going to put you with this person, or I will be with this other person, and go over best practices. So that will help. So keep going over best practices. It's more going over it. Sometimes trainings are just once a year. Once a year is not enough. You may have to do it every quarter, right? Just from my background of being a teacher, every time anything that has to do with safety or something that you want an outcome to be consistent, having a training at least one quarter will support the individual. You'll see a change. There'll be a change, even if it's trauma informed training. They have training. So just finding those type of trainings to send the CHW. So having those different protocols in place, because even while they're doing the work, they still should be going to some training, right? They should be still be, sorry, they should still be getting that support. And not to say like, okay, they're good. It's been, a couple of months, they should be fine. Just constantly still giving the training, even if you can't do it yourself. And it's okay, finding the trainings out there and the support.
Thank you, Soledad. I've scrolled up a little bit. And Jasmine, definitely not a silly question. Are CHWs mandated reporters?
Yes, they are. Because we're seeing, especially on levels that the doctors do not see, that the teachers are not seeing, we're in the homes with them. And that is something like you want to talk with your supervisor about on the protocols that your organization has for making those reports. But yes, CHWs are mandated reporters.
Thank you. There was also a question in the chat of any advice if the home visits are not scheduled.
When I first started doing home visits, we didn't have to make phone calls because at that time, well, I'm telling my age, but it's okay. At that time, everybody didn't have phones. So
Yes.
we didn't call to schedule appointments. But if I ever went to a door and it wasn't the right time, I always asked them, is this a good time? I know we wasn't, I've seen you already this month, but I just felt the need to come back and like sometimes what you discuss in your prior visit is a way to lead you back into an unexpected visit. And you take some information to them so it don't seem like you're just popping up just to get together, for the wrong reasons. Um, but they're usually, and it, I said back a while ago, but I set ground rules on my first visit. Well, that's one of the rules. If I ever come to your door and it's not a good time, I respect you to say, this is not a good time.
Yeah, 100% Lily. Same here. Crazy enough, we did not call to schedule meetings with clients unless I go to the home and I've been looking for them for a while. I didn't. For me, in my experience, doing those blind door knocks without sending, I found clients faster. So my caseload, I had a high percentage rate in finding clients because I didn't schedule. I would catch them at home, right? I know it's weird, and it was just one of the things at the organization that we could do. So here are some things. I did get police called on me, probably like 3 times from different clients. Some we knew, like someone just didn't. They was like, "Why are you at my door? You didn't call me." Blah 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 blah, right? I did. I've had police call me because I would leave a card like, this person, but didn't want. So one thing, you don't leave anything in their mailbox. We're not, I know in the state of New Jersey you couldn't, so I don't know how it is across. I know after 9/11, you can't put anything inside of somebody's mailbox. So there were cards like a call us back card because we're connected to their health insurance. So there was it was different. Like my leading line was, I work with their health insurance company, right? Even though we were a third party, but that was one of the things that we did. So I didn't have to call a client to set up an appointment. But if it's been a while and I went 2 or 3 times and even called, left messages, then yes, I'll do that. But for me to find clients, I had a higher percentage rate, not setting appointments. Yeah. Until you build that relationship is different, you set appointment, you meet them, but that was just how, you know, that's what worked for us at that time. I know it's weird. I know. Yeah.
Another question in the chat is how to engage in a home visit when you and the person don't speak the same language.
I know they have a phone number that you can call to do translation. But
when I had the full trees.
but if there's a person on staff that is bilingual, I usually try to pair it with them. Some people use the children. I don't like using the children because you're not sure if the child is actually saying what you're saying. And then to you know, this the information you're gathering is personal. So I'm not sure how much they want the child to be involved in that. But I usually try to team up with a coworker that is bilingual.
Yeah, I learned not to use the children to translate for you because sometimes they're just messing with you because kids are kids. Um, but one thing I would do before, because there wasn't always that phone number for translations, or I didn't always have access to it, is I would make sure my phone was working and we would text back and forth, and the text could be translated between the phones. And it felt awkward sitting next to somebody texting them, but we were able to do that. And then over time, I just got tired of doing that. I was like, it does not feel personal at all. And I received permission to use other individuals as translators, and they would join on a phone call and help translate different things for me.
May I share a lesson learned that I have been done recently? I am doing diabetes classes at home now that I am retired, and I do that in coordination with churches. Well, the other day I had a group that the pastor referred to me as newcomers, and when I talk to them, they don't even speak Spanish. They speak Mixteco, which is an indigenous language. And I say, oh my God, what I'm gonna do here? So I just use artificial intelligence. I transcribed what they were saying, and then I was able to get immediately in a blink of an eye what they were saying, and then I was asking again IA to tell me what to say, and it was kind of interesting interaction, but I was able to do the complete class about the healthy plate method. Actually, it has to be adapted because they ended not eating in place rather than like in small bowls. And I was even able to get some images from IA that I was able to share with them, and mission accomplished. So you might want to try that. I haven't see anything documented. I just get with that solution out of desperation, not knowing what to do, just still want to serve them. And I was able to do it in that way. There are also some others for those who work in organizations. When I used to work in CDC, we had a service. I am trying to remember the name when they do translation using a smartphone. And if some organizations can afford that type of services, that would be great. And so I think that some others may have already translator services in place, or you have to be connected through a smartphone, and in some protocols they require to have a tablet. But that's also a point to be discussed with the employers in terms of, providing quality services and services that are in compliance what the law says regarding the language.
Mhm.
There,
Awesome questions and discussion. We do have a few more minutes. If there are any additional, I'll allow for folks to either come off mute or put questions in the chat.
Andrea, there is a question in the chat from Alyssa. I think she was asking Betsy, which AI tool did she use?
Okay.
I am working with an organization that is called Bueno. And what I am doing is training their engineering IA in diabetes related programs. And so I do have access for that. And it has it is a more advanced ChatGPT or Google Gemini type of infrastructure, but still, you can still use the Google one and the regular ChatGPT. It all depends on, because what happened is that when you have ChatGPT, if you don't have the premium service, you will have certain amount of entries, and it's very limited. In my case, because I am working with this group training their system, I have a more robust type of ChatGPT, but I'm still using the other one, especially when I am not doing things that are related with the business that I am doing with them. I have been trying all kind of IA over there, mostly using the regular ChatGPT and the Google one.
Awesome. Thank you, Betsy, and really thank you all for hanging out with us today. This has been a great session, lots of gems. Even I have been taking notes along the way. So I am going to hand it over to Kim, who's going to give us our closeout instructions.
Thank you so much, Andrea, and thank you all again so much for your attendance here today. As Andrea just mentioned, we do have a brief evaluation that we would like for you to complete at this time to share your feedback. Again, we appreciate your time, your engagement, and you being here today. As a reminder, we will be posting the recording and a list of the resources that were shared today on our network's webpage for you to be able to access in a couple of days. Again, thank you all so much.